Hi, this is Gigi, and just want to talk about the session we had this past week with the integrative, or last week with integrative behavioral health care, and the things I got out of it. Was this very interesting class that we had, a lot of uh, useful information, and some of the takeaways as she talked about how that integrative care worked in the setting. Um, where she worked, and it just seems like that things work smoothly, and you're in making, uh, getting the history of the patient, making things brief, and just keep things going, so the patients can be seen and helped. And as workers yourself, just being available and being able to um, be able to present the case to the doctor and help on the behavior side. The other things I found interesting was the percentages of the patients. There are a lot of numbers that kind of stuck out to me. Um, uh, 90% of most of the patients that are seen in the uh, in the primary care by their primary health provider, they have such 90%. The issues are not of organic basis, and 70% of those patients, they're being seen for some kind of social issue. And so these percentages are good to know that when your patients are coming in, basically predominantly what you're dealing with and what you're working with. Those numbers just stuck out to me, of those folks that the people who don't follow up, or um, just the chronic diseases that they have along with the mental health. So that just stuck out to me, the percentages that they have. And the other thing, um, with the primary care providers not being equipped to really provide mental health care, though they provide a majority of the medicines. A lot of the patients, want to see their primary care providers providing antidepressants, but they don't really feel equipped to do so. So I found that kind of interesting that the primary care providers themselves are not that comfortable with prescribing antidepressants. I mean, they do it, but they don't feel equipped to give the right medications or to provide mental health care to their patients. But the patients are more comfortable with seeing their primary care providers. So that's also information that's good to know. And personally, I've been in a situation where I have a primary care provider that's trying to take care of, you know, in my case, it was more of internal medicine issues that he really didn't specialize in, and he was just trying different things. He wasn't sure, wasn't really equipped, but he was just trying different things. So that's um, a lot of the information that I got out of the class that we had. I thought it was pretty interesting. A lot of this stuff we have read about in our books, as we've been going the past couple of weeks in class, and I really appreciated the opportunity for this professional development.